Okay, so let's start. So I'll start with measles, mumps, and rubella. So Paramyxoviridae. So Paramyxoviridae. So the order is called mononegavirales. They are negative single-stranded RNA viruses, and they have a non-segmented genome. They're enveloped, so meaning there is a capsid. And then they have two enveloped glycoproteins. We have the fusion protein, indicated by F, and then attachment proteins, either H, HN, or G. So for H, we have hemagglutinin activity, HN, hemagglutinin and neuraminidase activity, then G is neither. So they neither have these two. So I'm going to show you a picture here. So the H protein, the one I was saying, and then, so this measles virus has the H protein, and we said the H protein is for hemagglutinin. So you'll see another virus has HN, hemagglutinin and neuraminidase, and then you'll see another virus has neither of these attachment protein. Then the F protein, which is for the fusion, as you can see in measles, it also has the F protein. Okay. Then, so for the Paramyxoviridae family, there are different genus, but what is relevant for us here is mumps and measles. So the genus is, there's Respovirus, human parainfluenza 1, renamed to human Respovirus 1 and 3. Orthobulavirus, we have the mumps virus here. Morbivirus, measles virus, then hepanivirus, Nipah virus. Respiratory syncytial virus, RSV, and metapneumovirus moved to a new family, Pneumoviridae. They were in this family, but then they were moved. Okay. So measles virus. So genus Morbivirus, as we had seen, it has the fusion and the attachment glycoprotein, H glycoprotein. Negative single-stranded RNA. It is linear and enveloped, so meaning it has a capsid. Used to infect nearly everyone before vaccine was available in 1963. Transmission through aerosol or direct contact. As you can see, anything that's transmitted through aerosol has a it's very contagious, because you can imagine I breathe, then maybe respiratory droplets drop on you. So it's very, very contagious. 90% or susceptible contacts. Man is the only host, no animal reservoir. Infection leads to lifelong immunity. Okay, so you can see here, this is the structure. We have the H protein, the F protein, the fusion one. Then we have the M protein. Then inside we have the nucleocapsid. So this is the inside. We have the RNA genome plus N proteins, then RNA polymerase. I think from the previous lectures, we had explained the role of RNA polymerase and RNA genome, but we're going to look again. Okay, epidemiology. I'm sure you've heard of measles from high school, primary schools. You know that measles is one of the diseases where we give vaccinations in children during 9 months. So it is transmitted through droplets or direct contact. Incubation period, 10 to 12 days. So incubation period means the time at which you get the disease and when you start showing symptoms. So if someone coughs at you, then you breathe in the respiratory droplets from the 10th day. So 10 days later, you start developing symptoms. So cost 140 deaths in 2018. Vaccine has reduced deaths by 75% since 2000. So it had a very high prevalence, but these days, due to vaccines, we are doing good. Most deaths occur in children under 5 due to immunocompromised. Your immune system is not well formed before you turn 5 years old. So pathogenesis. Infection begins at the upper respiratory tract. So as I said, someone coughs at you, you inhale the respiratory droplets. After inhaling, so the upper respiratory tract, this is the nose going to the trachea. it spreads to local lymphatic tissue or the lymph nodes. So the lymph nodes that are found within the upper respiratory tract. Viremia disseminates the virus to other tissues. So viremia means that the virus has crossed over and has got into blood. So when the virus gets into blood, it now goes to other tissues. We get a rash, okay? So this rash is very, very important. You'll see in children, as I'm going to show you in the next slides, the rash is very specific for measles. So it's type 4 hypersensitivity reaction. For type 4 hypersensitivity reaction, it's usually a delayed hypersensitivity reaction. So hypersensitivity reaction basically means your body is hypersensitive. So normally what happens is if you're having a normal reaction to something, let's say a drug or any microorganism, the immune system usually controls it. But now in this process, why we're calling hypersensitivity is because it has become hyperactive. You know, the immune system is overfighting that certain disease, okay? Then measles causes immunosuppression for months, leading to secondary infections, especially bronchopneumonia. So it's usually concomitant. You'll find like a patient who has measles can get bronchopneumonia caused by bacteria now, okay? So direct viral effect may cause giant cell pneumonia, which is rare. Recovery from infection confers lifelong immunity. So once you get measles and you recover from it, you have lifelong immunity. Clinical presentation. So incubation period, as we said, 10 to 12 days. High fever for 4 to 7 days. Then plus minus. So it may or may not be there. There's a classic triad of cough, coryza, and conjunctivitis. Okay. Then we have something we call Koplik spots. So Koplik spots, I'm going to show you a picture. Very, very specific for measles. Okay. You'll be seeing this in your exams. Okay. So I'm seeing someone is asking, what is coryza? So coryza basically is the infection, the upper respiratory tract infection. Okay. Yeah. So we have cough, the upper respiratory tract infection, and conjunctivitis. Conjunctivitis is inflammation of the conjunctiva. So you'll have redness, itchiness of the eye, okay? Then we have the rash, as I said, 14 days after exposure. Starts with head, face, then spreads downwards. Lasts about a week. So here are the Koplik spots. Can you see them? This whitish parts. And you can see this is the mucosa. This is the inner lining of the mucosa. Appears 1 to 2 days before the rash and resolves 2 days after the rash appears. Can you see them? Very unique or specific for measles, also known as an anthem. Then the maculopapular rash. Can you see? It affects the face, goes on to the trunk. We said it moves in a descending order. Then you see, this is very specific for measles. You're going to see other viruses cause such rashes, the maculopapular rash. Can you see this rash? And this is from a dark child. It's also known as mobiliform rash. Then these are complications. Bronchopneumonia, as we had said, your body your body gets into an immunocompromised state, and for that reason, other bacteria or other microorganisms can now enter your respiratory tract. So you get bronchopneumonia. So this is pneumonia that starts from the bronchus as it goes to the lungs. Then otitis media. So this is an ear infection. Then laryngotracheobronchitis. So this is known as CRU. So from the word larynx, so it affects the larynx, goes to the trachea, then finally goes to the bronchus. So this is inflammation of all those layers. Then we have diarrhea. It can also cause blindness and encephalitis. So encephalitis is inflammation of the brain parenchyma. So acute meningoencephalitis, subacute meningoencephalitis, or scleroid, sclerine panencephalitis. Okay, so this can also come in SAQ question where they can ask you name 5 complications of measles. So you have to know these. Or they can bring an MCQ and ask you all the following are complications of measles except. Okay, so you have to know this. So subacute sclerosing panencephalitis, 7 in a million cases, as you can see, it is rare, develops 1 to 10 years after infection. It is progressive and usually fatal. Survivors are severely disabled physically and mentally. So mentally, since we are causing inflammation of the brain parenchyma. So it begins with behavioral changes. So you have a change in your mood, your attitude, okay, the way you normally behave. Then it goes to motor. So motor refers to how you're moving. So motion. So you lose motor function. So if it's your hands, your legs, and then it goes to speech, then it affects your swallowing, then finally your vision. You become blind. It may last for weeks to years. So diagnosis. Diagnosis is usually clinical. We do lab tests. So serology, you take a blood sample, you're going to see IgM antibodies or paired IgG showing 4-fold increase. We do PCR. So the samples we need are throat or nasopharyngeal swabs, blood or urine. Then we can also culture. Treatment, usually supportive. We treat the symptoms, treat superinfection, rehydration, and antipyretics. So this, since we said it comes with a fever, so we need to lower the temperature. No specific antiviral license for measles, though ribavirin has been used for SSPE, as you had said. Okay, so basically what you should know is supportive treatment. Control vaccination. So since the vaccine has come, infection rates have been very low. Then post-exposure prophylaxis, so giving immunoglobulin or vaccine. So this is after you get the, you cannot really get, but if you're exposed to someone with measles, for example, you have 2 children, then one child comes to the hospital, they're confirmed to have measles, and they've been staying with the other child, we do post-exposure prophylaxis. Measles containing vaccines. They are live attenuated virus vaccines. 4 types: measles only vaccine, measles and rubella vaccine. So I'm going to mention rubella. Rubella is known as the German measles. Then this is given in Kenya at 9 and 18 months. Then we have measles, mumps, rubella vaccine, MMR, also common. Then we have measles, mumps, rubella, and varicella vaccine. So as you can see, this is covering 1, 2, 3, 4 viruses. And then varicella, I think we are done. Varicella is herpes zoster, human herpes virus 3. Okay, so these are the common ones. But in Kenya, we do MR vaccine. Any questions on measles before we start mumps? Okay, so if you were to summarize measles, what would you say? Measles is an RNA virus from Paramyxoviridae family. Highly infectious since it's spread through respiratory droplets or contact. Then we said the incubation period is around 10 to 12 days. Then for the symptoms, we said there's that classic triad of coryza, cough, and conjunctivitis, which may or may not be there. And then we have fever, then the specific spots or the rash that is in between your, or that is found in your buccal cavity, known as Koplik spots. And then we also have the maculopapular rash. Okay. And then we said, what else? For management, we do supportive management, okay? Rehydration, antipyretics for the fever. So there's no known antiviral for measles. Diagnostics, we said we do PCR or viral culture, and then we do serology, where we check the levels of IgG and IgM in blood, okay? And then complications, as we had said, so the rare one, but fatal, subacute sclerosing, panencephalitis. Others, we had blindness, we had otitis media, we had diarrhea, acute encephalitis, bronchopneumonia, okay? Yes, then CRU, or laryngeotracheal bronchitis. Okay, so that's the important thing you have to know about measles. And then the types of vaccines, you have to know the relevant one we give in Kenya is measles and rubella vaccine. Okay, so if you have no question on measles, sorry. So
Yeah, we're still
mumps. Okay, good. So continue with mumps. So mumps caused by Orthorubella genus Orthorubella, family Paramyxoviridae, as we had seen. It's an acute self-limiting viral infection, meaning you get it and then self-limiting meaning after a while you'll be okay. And then causes inflammation of one or more salivary glands, usually the parotid gland, in 90% of individuals. Okay, so this is very specific. If you see a question where they've put a picture of someone who has a swollen parotid gland, think of mumps as one of your answers. Okay, human are the only hosts. There is no cross immunity with other paramyxoviruses. What this means is, if you get mumps, if you had measles, you can still get mumps. If you had mumps, you can still get measles. So there's no cross immunity. Then here's the mumps virus. Remember the hemagglutinin, so HN. We have the fusion protein and then SH protein on the surface. And then we have the phosphoprotein, nucleoprotein, and polymerase. As you can see, quite long. Looks like a snake. So this is the mumps virus structure. Epidemiology, transmitted via droplet or direct contact, similar to measles. Incubation period is 2 to 4 weeks. Most frequent in children aged 5 to 9 years, but it can also occur in adolescents and adults. Clinical features, we call them non-specific symptoms, where they can, if a patient comes to you with fever, myalgia, which is muscle pain, headache, and malaise. So you can't really know that they're having a mumps infection. But now you'll see swelling of the parotid gland. It can either be unilateral, one side of the face, or bilateral, which is both sides of the face. Other salivary glands may be affected in 10% of cases. So the sublingual or submandibular glands can be affected. Usually resolves without sequelae. So sequelae is further complications. Occasionally, complications may occur. So look at this patient. So the parotid gland should be here, around here. Now you can see it has swollen like this. So if you see this on your exam, it looks like a mass, but it's actually a swelling on one side of the face, mumps. So this is known as parotitis, inflammation of the parotid gland. Complication, encephalitis, which is inflammation of the brain parenchyma. We can have deafness, otitis, So orchitis, 20% of young males who develop mumps. So orchitis is inflammation of the testes. Okay. So this is very specific. You're going to see in many MCQs, they're saying all the following are complications of, let's say, mumps, except when you see orchitis, think of mumps. Okay. Because I remember orchitis and pancreatitis, very specific for mumps infection. Okay. Then uveitis. Uveitis is now the female version, inflammation of the ovaries. We have neuritis and myelitis, so inflammation of the neurons and myelin sheath. GBS, also known as Guillain-Barré syndrome. So Guillain-Barré syndrome, I don't want to get into so much of pathology, but what happens in Guillain-Barré syndrome is the patients usually have bilateral weakness of the limb, and it is very specific as it will be ascending. So the patient will tell you, I cannot feel my legs. I cannot I cannot move my legs from the toes as it comes up bilaterally. So on day 1, maybe they can't wiggle their toes. Day 2, they can't move their ankle. Day 3, they can't move their knee. So that's what we call GBS, which can be a complication of mumps. Myocarditis. So inflammation of the myocardium, this is a layer of the heart. Pancreatitis, as I said, very specific for mumps. So mumps can directly affect the pancreas tissue. Arthritis, which is inflammation of the joints. So someone will present with maybe joint pain and then unable to move the joint because it's painful or stiff. Then uveitis. Uveitis is inflammation of the uvea. So the uvea is one of the structures of the eye. Okay. Then diagnosis. Oh, it's also clinical. So you diagnose using the clinical features. Specimen we take is saliva, urine, cerebrospinal fluid, and blood. Serology, you'll see IgM antibodies of mumps or paired IgG antibodies via ELISA. Then we have the hemagglutination inhibition assay. So checking for the hemagglutinin protein. Then we have PCR. Management, no specific treatment. So there's no specific antivirus that we have for mumps. And management is usually vaccination. So available in 60 countries only. Okay. Then you can have, before we go to rubella, you can have the protective measures where you have to cover your mouth when you want to cough and things like that. Remember how we used to do for COVID? Isolation, the same way, because it is spread via respiratory droplets. And then, yeah, we go to rubella. So mumps, the most important thing you should know about mumps is it causes parotitis, inflammation of the parotid gland. Then the two complications that you should remember, because they come up most of the time in MCQs, are orchitis and pancreatitis. Okay, nothing much. Are we clear? We go to rubella. So mumps, there won't be an issue. If you just remember those 2-3 things, you'll be okay. Rubella, as I had said, it's also known as the German measles. Okay, ideally from Germany. So it is caused by Rubivirus rubellae, family Matonaviridae, genus Rubivirus. Was previously in the Togaviridae family, but it was changed to Matonaviridae. Positive single-stranded RNA virus, and it is enveloped. Transmission, usually droplet or direct contact. Postnatal rubella causes a mild disease. Congenital rubella syndrome can be quite severe. So this is if the mother had rubella then the child got it. Okay, that is the one that is quite severe. So here's the rubella structure. As you can see, it is icosahedral, so 1, 2, 3, 4, 5, 6 sides. And then here's the RNA virus. We said it's positive single-stranded RNA virus. And then here are the glycoproteins. Okay. Yes. And then postnatal rubella entry, so respiratory epithelium, incubation period is 12 to 21 days. So that's around 2 to 3 weeks. Then we have local invasion of the respiratory mucosa. And when that happens, we have primary viremia. It crosses to the blood, to the reticuloendothelial system. So basically, these are the lymph nodes where it replicates. After that, there is secondary viremia, which happens 1 to 3 weeks after the infection. Dissemination to other organs. So when we have viremia, the virus is in blood. And remember, when blood pumps, it pumps to all parts of the body, and all parts of the bodies are the organs, which is the skin, mucosa, and other organs. Then immune response, thought to be responsible for the rash. Remember, we said the hypersensitivity, where your body is overreacting to that virus. So that's why you get the rash. Clinical features, as we said, also non-specific. Fever, anorexia. Anorexia means loss of appetite. And then you have a headache. Then we have pharyngitis, which is inflammation of the pharynx. Conjunctivitis, so inflammation of the conjunctiva in the eye. Tender lymphadenopathy. Suboccipital. So suboccipital is, if you were to draw, let me draw for you. This is the head. So you remember the head, occipital was, let's say this is the neck. So here is the occipital region. So here is where you'll have, here, this part is where you'll have tender lymphadenopathy. Okay. Then Hosheima's sign, which is found in 20% of the patients. So Hosheima's sign is pinpoint lesions or petechia in the soft palate. Okay, so soft palate, when you open your mouth, you know, if you're to bring your tongue, I want you guys to do with me. If you're to bring your tongue, take your tongue to the roof of your mouth, bring it, go to the back. So you start with the hard palate, then the soft palate. So you'll see some lesions there, or petechia. Don't confuse this with Koplik spots. Koplik spots for measles were found in the background mucosa. Or if you are to bring your tongue to the side of your mouth. That is where Koplik spots will be found. But for the Hosheima's sign, it's found in the soft palate. And then we have the rash. Let me see if I have a picture. Yeah, okay. Yeah, as you can see, the Hosheima's sign. So here is the soft palate. Also, so the soft palate extends. As much as you extend almost to the back of your mouth, it also extends to the under your tongue. So as you can see here, these lesions, and they're pinpoint, meaning they're very small, like the size of a pin on the palate here. And then the rash, the maculopapular rash, centrifugal, and they disappear after 3 to 5 days. You can see here. Okay. And then generalized maculopapular rash will affect almost the trunk, the whole body. Then complications of postnatal rubella. In younger children, we have encephalitis. As I had said, the inflammation of the brain parenchyma. Then in adolescents and adults, we'll have arthralgia. So arthralgia is joint pain, and arthritis is inflammation of the joints. Okay. Anytime you hear the word itis, it means inflammation. So the word AR, the letters ARTHR is joint. Okay. And then we have thrombocytopenic purpura. If I was to explain this, is thrombocytopenic purpura are so purpura are like, they're similar to rashes, but they are also pinpoint sort of rashes, but what happens is they include, they're not really rashes because the main constituent of those rashes are platelets. So what happens is, if this is the skin, if this is your skin, you'll see things like that. Okay, you'll see things like that. Okay, so the main constituent is, they're like microthrombi, and they mainly consist of platelets. Okay, so how they are formed is, you'll find that, in our skin, we have the capillaries, the very small, tiny vessels, and the arterioles. So what happens is, there'll be occlusion of these small, arterioles, and then now you'll see them manifest as these small, microthrombi, okay? Microvascular hemorrhage beneath the skin, yes. So that's how you define a pupilla, okay? Good. Thank you, Wycliffe. Okay, and then we have congenital rubella syndrome. We said this is the one that is most severe. Fetal infection occurs during maternal viremic phase. So the point where the mother has got the infection, has viremia. Destroys fetal cells, leading to necrosis, and it inhibits mitosis. So the division. Infection in first trimester impairs organogenesis. So you'll see rubella syndrome, we have microencephaly, so the small head, PDA, patent ductus arteriosus, and then cataract. So PDA, to simplify it, is a heart disease, okay? Where the patent ductus arteriosus is usually patent. It is left open. It should close as you're born, okay? And then we have sensorineural hearing loss in 60% of patients. Ocular abnormalities, so cataracts, glaucoma, retinopathy. So in cataracts, as you can see here, there is a haze, or we call this leukocoria, this whitish part of the eye is what we call the cataract. Then cardiac abnormalities, PDA, patent ductus arteriosus, or PA stenosis, pulmonary artery stenosis, abortion or stillbirth. Then in CNS, you'll have mental retardation, hypotonia. So hypotonia is when your muscles are weak, so they'll seem flabby, like, how the dolls look like. So that's how your muscles will be. Hypotonia. Then microencephaly, the small head, encephalitis. Then hepatosplenomegaly, which means hepato, so this is the liver and the spleen, they become enlarged. Then we have anemia and thrombocytopenic pupilla. Okay, so you have to remember these. These are complications of congenital rubella. This is also, it can also come in an SAQ question where you're asked 5 complications of rubella, or you're asked all the following associated with congenital rubella except. Okay. Diagnosis. It's also clinical. So you take a good history, and then you will see these clinical features. If it's postnatal rubella, the rash, conjunctivitis, tender lymphadenopathy, and the Freihen's sign. Then if it's congenital rubella, microencephaly, PDA, or a cataract. Then specimen, we have nasopharyngeal swab, urine, CSF, blood, and cord blood to check if the baby has also got viremia. Then serology, we have IgM or paired IgG, ELISA, IFA, immunofluorescent assay, hemagglutinin inhibition assay. Then we have PCR and viral culture. Management, it's usually supportive, treat the symptoms. Prevention, vaccination. Live attenuated virus, either single or as measles and rubella. So the way Kenya we give measles and rubella. Then health education. Basically, you educate the parents on these types of viruses. Okay, I have one. Any question on rubella? No question on rubella? Good. I'm glad you've understood. So you can answer for me this. One of the following is least likely cause of bilateral conjunctivitis: adenovirus, mumps, measles, rubella, rhinovirus. Answers in the chat. E, good. Rhinovirus. So we did rhinovirus. Can you remember? When we were doing picoRNA viruses, piconaviruses. Okay. So rhinoviruses, how I remember rhinovirus is rhinoviridae, family rhinoviridae, and it is the one that is causing the normal common flu you get. Anytime you get a common cold, or as we call it, homa, just remember that is rhinoviridae. Do you usually get conjunctivitis? No, you just get cough, runny nose, maybe you're tired, sometimes headaches, okay? And then one of the following is true about measles, but not rubella. So answers in the chat. E, good. Koplik spots. Remember I said Koplik spots is very specific for measles. Yeah, there. I'm done. Any question on measles, mumps, rubella?